Okay, I'm here to talk about my hair, or my lack of hair. I want to talk about my hair journey because this is something that I've gotten so many questions, DMs, emails from all of you asking what I'm doing, why is my hair falling out? It's something that I see clinically in my clinic a lot, women coming in complaining about hair loss. And this video isn't going to be all about the medical side. I just really want to speak on a personal level and kind of tell you what happened to me. And maybe there's something that I say that might help one of you. So in 2022, I was prepping for my first bodybuilding competition. And I competed in April of 2022. Shortly after that, I got sick with a respiratory virus and had a high fever. And after that, my hair started falling out. And it was something called telogen effluvium. So the hairs on our head are in lots of different phases of resting or growth or fallout phase, essentially. And what telogen effluvium is at different stages in our life, we can go through stressors like pregnancy or illness, high fevers, and it can trigger something called telogen effluvium, where the hairs that are in their resting phase all of a sudden just get pushed into the fallout phase. Because normally the hairs on our head, because they're in different phases of the cycle, we do lose about 100 hairs a day. But when you have a stressful event that can trigger something called telogen effluvium, all the hairs just start falling out, and it is very diffuse shedding. So it's all over the head. It's not just like one spot. And that's what was happening as I was brushing my hair. There was excessive amounts of shedding. Every single time I took a shower, the shower drain, I could pick up like a huge clump of hair that was falling out. And it was really emotionally distressing because I knew that with telogen effluvium, even if I knew the reason, which was my bodybuilding competition and my illness, that it takes a long time to regrow hair. Human hair grows on average about 6 inches per year. And I had grown out my hair for Mrs. Nebraska and Mrs. America. I didn't really want to cut it short, so I started to frantically start looking for things that would help my hair. Well, the shedding stopped after about a month or two. So by August, I was starting to see some regrowth on its own. I really wasn't doing a lot at that time besides taking collagen. I've been taking this for years, Sparkle Collagen, which of course everybody thinks of collagen when it comes to hair, skin, and nails. And so I had actually used this product to help grow my hair out for Mrs. America, and it did an amazing job. I grew my hair. It was beautiful. I loved my hair. But then what happened was in October of 2022, I traveled to Santiago, Chile, and I got another illness when I came back, and 2 days later got salmonella poisoning from food, and I had a fever of 105.6, a horrible fever, and a couple weeks after that event, the shedding started again. And you can get something called chronic telogen effluvium, where it just like keeps shedding and you can't get that shedding phase to stop. But it started happening again, and that's when I really panicked because I had already lost so much hair over the summertime and I was starting to see some regrowth, and now it was falling out again. I started really sharing this on social media because I was like, hey, listen, what advice do you all have? I know as a doctor that telogen effluvium, like I said, you just have to be patient, it will come back. But I started to think, what could I do to maybe help accelerate that? So I want to share what I did. Immediately, you all started sending me oral supplements, try these serums, try these lotions and potions and all the things. So I started using a lot of topical agents on my scalp. Well, what I found is because I have long hair and I have kind of naturally like oily hair, I didn't love all these scalp serums and things like that. It was really kind of gunky on my scalp, and I only wash my hair every couple of days. Now you want to make sure that you take care of your actual hair because this isn't live living tissue. The only thing that's alive is the little follicle here in the scalp. But you don't want to overheat your hair. You want to use nice products on your hair that don't dry it out. So you don't want to excessively wash it or use really hot flat irons and curling irons and things like that. So I had already done a lot of that when I was prepping for Mrs. Nebraska and Mrs. America. But what I started was all these serums. Now, another thing that you hear people talk about is Rogaine, right? And Rogaine's not just for men, it's for women too. I did a reel on this. I have some saved stories on Instagram as well that you can go check out. But what Rogaine does is it helps keep those follicles in a growth phase. The problem with Rogaine is that when you stop using it, it goes back into fallout phase. So sometimes it can just be a short-term solution. You have to use it for a really long time. And the Rogaine foam that I was using, my hairstylist was very concerned that it could change the color of my hair because I have color treated hair. So I literally used that for about 48 hours and then I stopped using it. But I said I was fed up with all these serums going on my scalp. So I used those really for only a couple weeks and then I discontinued use of almost all those serums. One thing I did use on my scalp though is a peptide called GHK copper. And GHK copper is a peptide that can really help with skin elasticity and hair growth. And so I have a GHK copper spray that I continued to use on my scalp. I would use it before I blow dried, or sometimes I would put it on at night if I could remember, but it was nice because it was quick drying and it didn't add a lot of oils to my scalp. So that was the only thing even to this day that I continue to use. And I do use GHK copper serums on my face and do think it really has a lot of science and clinical data behind it. I don't have the one that I use on here. Not selling you any products. I'm literally just telling you what I have done to help with my hair. The other thing, because I had been doing a bodybuilding competition, I was on a low calorie diet, and any sort of diet that causes weight loss can cause telogen effluvium. So I started to increase my calories anyway, starting to refeed from my bodybuilding competition, and actually went into a phase of trying to build, to grow muscle. So I was actually coming into a caloric surplus and eating tons of calories. At the time of the filming of this video, I'm eating upwards of 2,600 calories right now. And what's good for growing your muscles is also good for growing hair. So I was boosting my protein, boosting my calories, but I wanted to make sure that I didn't have a nutrient deficit. Now, a lot of hair, skin, and nail vitamins will contain things like biotin, which can be good for hair growth, but a lot of it will contain other things that just help bring blood flow to the scalp. And so there are some other well-known brands out there. One of them is called Nutritional, but I started using this supplement called Goldilocks. First of all, this packaging is just really pretty. If you're a woman like me, it just looks better sitting on my shelf with this pretty packaging. But I have consistently been taking this Goldilocks supplement. And because I pursued hair extensions, and I'm going to talk to you about these in a second, they also have a line of products that are suitable for extension hair. So I switched to their shampoo, their conditioner. They have a dry shampoo. They have like a hydrating serum for the hair. And then I started taking the oral product. We can put a graphic up here on the video of a comparison between Nutrafol and Goldilocks, but I've been using this and I really like it. I'm starting to see hair growth. I'm getting these like short hairs that are growing back in. But I did start taking this Goldilocks supplement. The other thing I started doing is red light therapy. And you guys have seen me share about the Cozy Red Light for a while now. This is the travel edition. I'm going to turn this on, so I'm about to get very red. But this is the travel edition of their light. And I only am showing you this one because it's small. But you can put this pretty close to the scalp. They don't make like a helmet, but there are some red light devices out there that do come in that helmet form that would treat the whole scalp. But I've just been using my panels. I have the travel light, I have a medium-sized panel and a large panel, and I've just been putting this close to my scalp. You can get it within 6 inches. You can get it right up against the scalp. But this contains near infrared and infrared light, and those particular wavelengths of light actually go into the scalp, into the mitochondria. They help increase the blood flow and increase the energy out of the mitochondria to help regenerate the growth in that hair follicle. So there is clinical data behind red light therapy, and I've been using red light on my scalp. I've been taking collagen. I've been taking the Goldilocks supplement. And the last thing that I've been doing is something called PRF, which stands for platelet-rich fibrin. And these are actually injections in the scalp. So this is where I went to a place here in Omaha called Artisan Aesthetics. And they took my blood, they spun it down, and then they took that PRF that comes from the plasma in my blood, and they injected it into my scalp. So they injected it into the temples of my scalp, kind of up here in the crown. And what that PRF does is, once again, helps stimulate those follicles to start regrowing the hair. So I knew with telogen effluvium that my growth would come back, but I was looking for something that would help it come back very robustly, maybe grow my hair a little bit quicker than average, because my hair was long, and everybody said, well, just cut it off and just know that it's going to regrow. But hair is such a deeply personal thing to women, right? There are studies in breast cancer patients that they say they would rather have their breast cancer back than lose their hair. I mean, that is how deeply emotional it is for women to lose their hair. It's part of our identity. It's part of how we show up in the world. And I really didn't want to cut my hair off. So I started these treatments, and I also got hand-tied hair extensions. So as of today's video, I just had these reinstalled today. So I just had them out for a day, and my hair is so thin from the telogen effluvium. So this is my hair extension right here. I just have one row of Weft Bellamy Pro hair extensions, and your salon artist can color match this to your hair. The person that did my extensions here in Omaha is Kim Schultz, Beauty and Body by Kim, and she's at Authentically You Salon. You can go in for a consultation and she can take a look at your scalp, she can take a look at your hair, and she can determine what's best for you. A lot of you messaged me talking about wigs and something called a fall, which is basically like a wig that you can put on top. But because I'm so active and I go to the gym and I sweat and I'm in the operating room, I can't really wear a piece like that. So it's nice to have these hand-tied extensions. When I first got them, I thought that I would hate them. I thought that it would feel like heavy, painful, that something was on my head, that I would feel them at night when I slept. And it really has not been the case. I literally can barely feel them. So they're permanently attached basically to my hair. I wash my hair with them in. I only wash and blow dry my hair about 1 to 2 days per week. And I use those Goldilocks products on the hair. And you want to just be really kind to the hair because the extension hair doesn't have a blood supply from your scalp. So you don't want it to get over dried. You want to use oils and products on it. You want to brush your hair and brush the extension hair multiple times per day to distribute those hair oils. You don't want them to get over dry. I wear a silk scrunchie at night and pull it back so that nothing gets matted where the extensions are attached. And if I'm ever going to put something on my head besides a scrub cap, but like a helmet, when we went snowmobiling, I had a silk cap that I just placed over my hair to help protect it. So just a recap of the things I've done and the things that I have found helpful is I'm taking a nutritional supplement. I'm making sure that my diet is high in healthy fats and in protein. I'm taking another specific collagen supplement from Sparkle. I do have a discount code on these products. My code for almost everything, you guys, is Dr. Fit. So if you're not sure if I have a code, if I do, it's Dr. Fit. So you can always try that in the little coupon code box, DRFIT. But I do have that for both Goldilocks and Sparkle. I don't make a penny, you guys, but I've been using these products and I just ask for discounts for my followers because I know that you guys are gonna ask. The Cozy Red Light also, this is definitely an investment in your health. You can use it for more things than just your hair. You can use it for your thyroid, your skin. You can use it on your joints. It's pretty amazing what red light therapy is used for. If you go to PubMed and do a search, there's so many applications of red light therapy, but same thing, discount code is Dr. Fit on that if you want to use it. You could also look into PRP or PRF injections into the scalp. It is a little bit pricey, but for me, it was something that I really wanted to try. I did 3 rounds of treatment essentially. You want to space them out about 4 to 8 weeks and find somebody that is knowledgeable about treating hair this way. But I got that injected into my scalp as well. I am definitely starting to see regrowth. We've got all these little baby hairs. It looks like I have bangs, but they're all over. So I feel like a chia pet almost. It's thick at the scalp, but down here it's very thin, which is why these extensions have just been nice because I can keep my long hair. And eventually, once my hair grows back out, then I won't have to wear the extensions anymore. But it's been a nice short-term solution for my telogen effluvium. Now, there's lots of other reasons for hair loss. There can be androgenic hair loss. You can get hair changes with aging. You can get mineralization of the follicles. Of course, any sort of medical treatment, certain medications, cancer therapies. There's lots of reasons why people can have hair loss. Fungal infections of the scalp. And viruses and things like that. But telogen effluvium is a really common reason for hair loss. It's something I have been suffering with, and I'm just being open and very transparent with all of you in this journey because we're all human and we all deal with these things. So I hope something in here was helpful. Share this with somebody that's going through some sort of hair loss journey. If you guys have tips and tricks for me, drop them into the comments and or questions too if you have them. See you guys.
Did you guys love that last episode of the Fit and Fabulous podcast? Well, of course you did. And I want to keep bringing you the most amazing content from the most incredible people. And you can help me by subscribing to the Dr. Fit and Fabulous channel. You guys know where the button is. Just click it. It's the doctor's orders.